So today I'm going to discuss few question and answer, which is the NCLEX board certified questions about the pediatrics. The first question here, a client with a psoriasis visited to the dermatologic clinic. When inspecting the affecting areas, the nurse expected to see what type of secondary lesion. So, examiner asking the question about the psoriasis. This is the keyword. Psoriasis is a chronic skin disease which result in the scaly, like this is the scaly. So this examiner asking which inspection affected area the nurse expect to see. Number one, scaly, karst, ulcer, and scar. The characteristic feature of psoriasis which result the scaly lesion. It is often itchy, right? So scaly, they say. So a scaly is the characteristic secondary skin lesion occur in psoriasis. Although the karst, ulcer, and scar also are the secondary lesion in the skin disorder, they do not occur in psoriasis. NCLEX board asks a question. When you can see the karst, okay? The karst we can see in impetigo. So this is the karst, okay? And this is the karst. Karst is common in impetigo. Impetigo, a highly contagious bacterial skin infection that affect the infant and children. If you do not diagnose or if you do not give appropriate antibiotics, impetigo can affect the kidney. And impetigo, as I told you, highly contagious bacterial skin infection mostly affect the infant and children. Next question here, a client with a sacral pressure ulcer is limited in the 2 hours of chair sittings 2 times per day. And she is scheduled for physical therapy 3 times per day and dressing change 2 times per day. How can the nurse best coordinate this client care? So our patient have a pressure ulcer. When you make the care planning, the posture change is very important, right? So number one, ask the physician if physical therapy can be changed to 2 per day. So the client need to get out of the bed only 2. Number two, coordinate the physical therapy with getting the client out of the bed for breakfast and dinner. Then request the bedside physical therapy for 3rd session. Number three, request bedside physical therapy for all 3 sessions so the client can get out of bed when she wants. and also ask the physician to discontinue the physical therapy until the client has no activities limited, right? Limitations. So the correct answer said coordinate the physical therapy with the getting the client out of the bed for breakfast and dinner, then request the bedside physical therapy for third session. Why we choose number 2? Rationale said the nurse should attempt to coordinate physical therapy with getting the client out of the bed for breakfast and dinner. And she should then request bedside physical therapy for the third session until the client has no activity limitations. Coordinating the client activities optimized the client ability to participate in physical therapy because she can go to the physical therapy department for therapy. Discontinuing therapy session placed the client at the risk for complication associated with immobility. So in this picture, we can say if any patient is immobile and if any patient does not change the posture frequently, they have a chance to develop pressure ulcer, so-called bed sore. In this picture, we can see the bony prominent, like here, ankle bones, we call heels, have a chance to develop ulcer. Lower back and buttock, sacrum, elbow, shoulder, and back of head. So this is the prominent bony area, always friction with the surface, chance to develop the pressure ulcer. Pressure ulcer or bed sore also, pressure ulcer also called the bed sore. It is also known as decubitus ulcer. So ulcer basically injury to the skin or underlying tissue result from prolonged pressure on the skin. So how we can prevent it? And what are the risk factors and what are the complications? It is important to know. So frequent change the posture or posture change can improve the ulcer and can prevent the pressure ulcer. What are the other ways can prevent? A good nutrition, lifestyle change, like complete cessation from smoking, exercise. Also use the pressure relieving device, such as the air mattress or water mattress. So in this picture, we can see the bony prominent area, heel, sacrum, elbow, shoulder, and back of the head. If you lie down, in this, if when the patient's lateral position, ankle, knee joints, hip, shoulder, and ear. In the sitting posture, chance to develop elbow, back of the shoulder, sacrum, and buttock. So posture, frequent posture change is important, and also it is very important to find out the risk factors and prevent it. And bed sore or pressure ulcer most often develop on the skin that is covered the bony area of the body, like this, bony area, like this. Next question. A nurse is developing care plan for a client recovering for a serious thermal burn, right? Thermal burn. After the remaining the respiration, the nurse knows what the most important immediate goal of therapies. So if anybody undergo to the burn, what are the most priorities? Planning for the client rehabilitations and discharge. Number 2, providing emotional support to the clients and family. Number 3, maintaining the client's fluid, electrolyte, acid-base balance. Number 4, preserving full range of motion in a affected joint. So when patient diagnosed the burn, it is life-threatening conditions, right? All is important, but what are the most priorities, right? The correct answer said, maintaining the client fluid, electrolyte, and acid-base balance. Because saving the life is the most priorities. So rationale. So I want to tell you the burn are the tissue damage that result from the heat or overexposed to the sun or other radiations, or even chemical or electrical contact. And burn can be minor medical problems, or even it can cause life-threatening emergencies. And treatment of burn depends on the location and severity of the damage. NCLEX board asks question, if a patient have a burn, what kind of solution or saline solution we prefer? We always prefer lactate ringer solution. And another question NCLEX board asks, how we calculate the how much fluid my patients need? We follow Parkland formula. Parkland formula, I said. So rationale here, after maintaining the respirations, the most important immediate goal of therapy for a client with a serious thermal burn is to maintain the fluid, electrolyte, and acid-base balance to avoid potential life-threatening complications like shock, disseminated intravascular coagulations, respiratory failure, cardiac failure, and acute tubular necrosis. So burn patients lead to complications like shock, and shock lead to death. So fluid is important. But what kind of fluid we chose? We chose lactate ringer. So lactate ringer solution, also known as sodium lactate solution or Hartmann solution. is a mixture of sodium chloride or sodium lactate with potassium chloride or calcium chloride in a water. And lactate Ringer's solution is used for replacing the fluid and electrolyte the burn patient, or even who have very low blood volume, we can use it. So planning for the client rehabilitations and discharge, providing emotional support and also preserving the fluid range of motion in all affected joints are important aspect of the care, but do not take the procedure over the maintain the client fluid, electrolyte, and acid base. All is important, but most important or priorities is the fluid. NCLEX board asks question, how we calculate how much fluid need my patients? We use the Parkland formula. So Parkland formula is mathematically expressed, right? So they said, according to the formula, 4 ml, this is the constant, 4 ml times or multiply body surface areas in percent and also body weight in kilogram, right? So body weight is the mass of a person in kilogram, and body surface area is a percentage of the total burn surface area of the body in percentage. So what are the total amount? Half of the solution for first 8 hours we inject to the patient, and rest of the half of solution for next 16 hours. So Parkland formula used to rule of 9 to calculate the burn replacement amount. So rule of 9 formula we use. Let me read it. The Parkland formula apply only the second and third degree burns. According to the formula said, volume is of the lactate Ringer solution 4 ml times body surface area in percentage times body weight of a person in kilogram. Give the half of solution for the first 8 hours and give the rest of half of solution rest of 16 hours, next 16 hours. So the formula used to rule of 9 to calculate the burn, replace the amount. It is important to know the patient's hand approximately 1% of the total surface areas. The next question, which nursing intervention can help the client maintaining the healthy skin? Number 1, keeping the client well hydrated. Number 2, avoiding bathing the client with mild soap. Number 3, removing adhesive tape quickly from the skin. Number 4, recommending wearing the tight fitting cloth in hot weather. Wearing, right? So the nursing intervention can help to maintain healthy skin. Correct answer is keeping the client well hydrated. Rationale said, keeping the client well hydrated help to prevent the skin cracking and infection, because intact healthy skin is the body's first line of defense. So our intragomental system or skin protect your body to against the pathogen, bacteria, virus. It is the first defense of the body. To keep a client maintain the healthy skin, the nurse should avoid the strong detergent and should use the mild soap and water. The nurse should not remove additive tab quickly, because this action can trip to the skin. The nurse should recommend wearing the loose fitting dress, not the tight fitting, right? Next question here. A client from nursing home arrives at an acute care facility for the treatment related to the complication of chronic obstructive pulmonary disease. So chronic obstructive pulmonary disease, also known as COPD, right? It is a common, preventable, and treatable disease that is characterized by persistent respiratory symptoms like progressive shortness of breath or cough. So a nurse performing admission assessment note to present a last stage number 3, pressure ulcer. The client's daughter asks if hospital can treat the sore. What are the initial actions should the nurse take? So these questions, again, the pressure ulcer, and the stage of ulcer is the number 3. Number 1, contact the nursing home administrator to obtain permissions for a wound care specialist to see the client. Number 2, refer the clients and his family to social services. Number 3, initiate the consult with the facility's wound care nurse. Number 4, collaborate with the physicians to obtain an order for wound care nurse to see the client. So the key point is here, your patient has a COPD, also pressure ulcer, but the stage is number 3, very bad conditions. So the correct answer, collaborate with the physician to obtain an order for wound care nurse to see the client. So rationale said, as a member of a healthcare team, the nurse should initiate the collaboration between the other team members, and she will need a physician's order to establish the contact between the clients and the wound care nurse. After the client's admission to the acute care facility, his physician must provide orders for referral and consultations with the services the client needs. And this is not the responsibilities of the long-term care facilities administrative teams. And there is no need for social service intervention at this time. Another question again about the pressure ulcer. A nurse has noticed an increase in development of pressure ulcer in the nursing unit, and give this seriousness of matter and what should the nurse do first. So it is very important to know nursing care and management of the pressure ulcer. Number one, formally report her concern to the nurse manager. Number two, begin an investigations concerned potential cause of the pressure ulcer. Number three, review the chart of the clients involved to assess for pattern and trends. Number four, do nothing. This problem is not the nurse responsibilities. So the characters say formally report her concern to the nurse manager. So here the rationale said a nurse who identified the issues involved the quality of care. So because of your negligence, like you do not change the patient position every 30 minutes or every 2 hours. And if you, because of your negligence, patient chance to develop the pressure ulcer. So although there may be a need for an investigations, the nurse should not initiate one without discussion with the nurse manager. Also, chart should be reviewed after a formal investigations is established. The nurse responsibilities include identifying and reporting issues and concern involving the client care. Before to go next question, I want to share few of the information. What are the risk factor can cause the pressure ulcer? Right. First of all, and also it is important to know the nursing care. So they said spend most of the day in the bed or chair, sitting or lie down for a long time, immobilizations. Point, overview or underweight, both is bad. Also, are not able to control the bowel and bladder, and also have a decreased feelings in an area of your body. So if anybody has a diabetes neuropathy, chance to develop the ulcer. And also spend a lot of time in one positions. So position changing is important. So what are the cardinal signs of ulcer? Like skin redness, warm in temperature, or hard skin, erosion of the skin or layer. So this is the sign. So here I want to tell you, nursing care is so important. So a nurse who I believe I can done this. Next question, another question about the pressure ulcer. A nurse is caring for elderly bedridden adult. To prevent the pressure ulcer, which intervention should the nurse include in the care plan? Number one, turn and reposition the clients at least once every 8 hours. No, it is not. It is so long, right? Every 2 hours is okay. Number two, vigorously massage lotion over the bony prominence. Number three, develop a written individual turning schedule. Number four, slide the clients rather than the lifting when turning. The characters say develop a written And so individual turning schedule, because it is so very important. So posture change can prevent the facial ulcer. So rational say a turning schedule sheet helps ensure that the client gets turning and thus help to prevent the facial ulcer. Turning should occur every 1 or 2 hours, not every 8 hours. For the client who are in bed for prolonged period, for every 2 hours, not 8 hours, they say. The nurse should apply lotion to keep the skin moist, but should avoid vigorous massage, which could damage the capillaries. When moving the client, the nurse should lift rather than the slide. So nursing care for the client experiencing facial ulcer or bed sore usually include assessment is so important. Assessment, the contributing factor that leading to lack of tissue perfusion, or assessment that what are the underlying injuries, or promoting the compliance to the medication regime. So next question here, when assessing an elderly client, the nurse on the bed, on nurse on the day shift, note redness in the sacral regions. And close assessment reveal the small breaks in the skin surface. The client says the area is tender and must have lost the skin when nursing assistants on the previous shift moved him. And he tells the nurse the nursing assistants on the last shift was rude or rough. I asked her to look my backside, but she told me she was too busy. What should the nurse do, right? So again, I said it is very important to nursing care the patient who have a burn. Prepare the incidence report. Number 2, prepare a disciplinary warning for the nursing assistants. Number 4, document her findings and also contact the shift supervisor. The correct answer documents the findings. The nurse rationale, the nurse must first document her assessment findings, and timely documentation helps ensure the accuracy. The nurse should notify the shift supervisor after completing the documentations. She must follow the chain of commands. The nurse is not a manager or supervisor and may not have authorities to administer discipline, although it might be appropriate for the nurse to make an incidence report, and she does not yet have adequate information to prepare a complete report. Next question here. During the acute phase of burn, a nurse should assess for what? The client lifestyle, alcohol use, tobacco use, and circulatory status. The correct answer is circulatory status. This question talked about the acute phase of burn injuries. So when you assessment which one is the most important? To check the circulatory status. Rational said during acute phase of burn, the nurse should assessment the client's circulatory, means blood, and also respiratory status, means cardiovascular and respiratory systems. Then vital signs, fluid intake and output, ability to move and bowel sound, wound and mental status. Information about the client lifestyle and alcohol and tobacco use may be obtained later when the client's condition has stabilized. So the treatment option here, beside of medical treatment, we always give the nursing care. So if a patient is undergo to the burn, the medical treatment also we do. So after you have received the first aid for a major burn, so medical care may include medications and products that are intended to encouraging the healings. Here we have discussed few question and answer, particularly about the pressure ulcer and burn patients. The old people say, if you believe and if you do something with trust and believe in yourselves, you can achieve anything that you set in your mind. So do and practice with confidence. I like to believe you will get your license.